The Abdul Latif Jameel Poverty Action Lab. Translating research into action.
So now we'll turn it over to Ms. Sheepa Hafiza, and she also has her colleague here, Ms. Banerjee, who oversees the Adolescent Development Program. She'll also be supporting the presentation and answering questions specifically on those programs at the end. We'll have 5 minutes, just as we did for this one. Thank you.
And they are, within a day or two, they're into the school, attending exams, and they're reintegrated, just like any other one. And a couple of them have never been reintegrated, although we are providing all kinds of support, also psychosocial support to their parents. And the reason, what we understand now, from just apparently what we understand is, where the parents are providing support to the young girl within the household even, they are the ones who are, attending school and becoming more integrated. But when everybody else is providing support, and parents are saying, yes, it is, yes, it's not her fault, and she herself is saying it's not her fault. It's not because it happened, not because she had done something wrong. But it is our assumption. These parents are not really taken it in a way. Their mindset is not yet changed about rape of their girls, and these students or children are not coming back to school. So as because that was the kind of a thing working in our minds, so we thought we give a presentation of a program which is working with the whole family, men, women, children, and of the community, and let's see what are the results from there. But that not necessarily will mean that we have done so or anything. So, historically, from 1972 when BRAC started, the empowerment was the goal of BRAC. And obviously women are in the heart of the whole development program and thinking of BRAC. And from 90s onwards, really BRAC has taken the whole empowerment, a comprehensive programmatic approach, where empowerment and gender equality is an issue, but at the same time, BRAC started working with their own staff within the organization to make the organization as an engendered organization. And Gender Justice and Diversity, a division, which is working on behalf of BRAC to facilitate and monitors gender equality, knowledge building and sensitivity in the organization's programs and also in the departments. So what is the approach? It's aimed at improving quality of BRAC's community-focused programs along with improving gender relations within the organizations. Therefore, a drive to empower staff is to facilitate empowerment at the field, grassroots and programmatic level. And BRAC started believing in, if BRAC staff are not empowered enough, then it will not be possible for them to facilitate empowerment with the people who they are working with. Obviously, the quality focuses not only on increasing money, women's income and assets, but also their negotiation skills, voice and control over their bodies, choices, time and mobility. Also, men engagement to challenge gender stereotyping and mainstreaming it. So, the challenges of measuring gender norms changes are obviously most development programs do not challenge traditional approach of gender roles and relations. Also, mainstream development is very interested to know the numbers, and absence of what I want to say is feminist perspective from planning to evaluation gives distorted and sometimes gender blind outcomes. Even when someone wants to know about violence against women, and there are many research available, studies available, and at least it happened to me that in one time I find out almost all of the research studies has either directly or indirectly there is a notion of that men are violent because they are exploited and they are frustrated, so they become more violent. So obviously a question arises, if men are exploited and frustrated and they're violent, then what should be women's role? Is at least we know how women's violation, exploitation and frustrations are there. So why not they are violent and more than others? So this is one area, and then of course, as very nicely Rachel already talked about it, how it is important to contextualize the tools and techniques and whole methodology. So I'm not going to go into details with that anymore. So what this program of BRAC is adding, beyond conventional approach, engaging all sexes and age groups and classes. So it is working with the men and women, start with men and women, and then with the family. So it works from within the household level, but these people become the change agents of their own community as well. And focused to strategic interests of women with the link of practical gender need. So the focus is a respectful, dignified relationship between men and women, and which brings into even agendas like how they are distributing food within the household, who is eating first and who is eating what, who is getting treatment when they are not well, to everything, whatever happened in the household level. So they are both women and men are actively involved in identifying the problems and issues, and also they are active on the issue, and they are doing it from their household because families are acting on it, but at the same time they are acting as a change agent of the community. And also this work, we are working as learning laboratory to leverage cutting edge approaches for programs to address gaps. So like big programs, if it is an education program, and as we all know that Bangladesh has achieved gender parity in both primary, secondary education and enrollment. But at the same time, the completion rate is very low. So what do you do? So as Mahmouda was asking, so there is also a program working on how to combat sexual harassment at public places with the students and the whole community. And from that work, we have this understanding that even doing everything and whole community is very vibrant and proactive. Still then, when there is a very serious case like rape, it's so difficult to handle by the community and the girls. So, where others are not working, at least, like when we talk about domestic violence, there are different programs are happening, but within the domestic level, within husband and wife, this program is working with the husband and wife and with their children, so that it can be reduced. So let's see what's happening. What we want to see that the gender role and relationships of both men, women and children has been changed. Equitable access to healthcare, nutrition, education and rest and recreation, among other things, mobility and all those. Women's ownership in asset and income, gender-based discrimination and violence reduction in household level, and community mobilization against gender-based discrimination and violence against women and children. So like, what are the outputs? So one output can be gender role changes at household level. How do you see that? So what men are doing in the household level, women are doing in the household level, those are the things. So we particularly focus on to see how men are changing or not. So what kind of, even whether they are taking care of their children, bathing them, feeding them, cleaning the house, washing clothes, whether women can visit their relatives or friends whenever she wants to without being asked by somebody else. Women can enjoy any events, cultural events around her. So those are the things we look at. And also the mobility is an issue. And for that, the indicators such as where women can go and how often she can go and whether she can go whenever she wants to go. So it's not only that women can go up to this pond and then she cannot go beyond. So there is nobody, no other person is making decisions for herself whether it is happening. Of course, women are working outside whatever they want to. Women having bank account savings can spend her money as per her interest. And obviously when man is taking the part, doing the household, helping the household with household level, so there is a kind of a balanced situation we are expecting. So in these areas, what do we see? And more details for gender role, men involvement in domestic work, including cooking, washing, childcare. Increased rest and recreation for women, whether it is happening. For equitable access to health, nutrition, food, obviously, are men and women and children eating together, at least taking one meal so that they know who is eating what and how. And when a woman is sick or her daughter, whether they are getting the treatment on time, just like a boy or husband, and when they are pregnant, whether they are getting their extra kind of care from the household. Obviously, whether girls and boys are going to school, and this is like 100% households they are going. So we are working with almost more than 1,000 villages, like 390,000 households. Women ownership of assets, whether one is their skill has increased, their bargaining skill also increased or not. They can purchase things on their own choice, whether property is shared to daughters and wife's name. House of gender-based violence reduction, wife beating, child beating has reduced or not. Physical, mental abuse is recognized as a crime. And for community mobilization is creating a space and platform for women for solidarity building, and also act on child marriage, polygamy, dowry and violence against women. Some of the results I can share. About dropped out girls are going back to school, like 92% girls are going back to school once they were dropped out because of many different reasons. Also boys, 91% boys are going back to school. And women's participation in asset transfer, women and girls. When we are saying even wife, they are mostly girls, as we know. In Bangladesh, most of the marriage happen to the girls when they are not even 18, when they are 12 and 14. So these are, a big number of them are not really women, but the girls. So raising their voice, like 58% raise their voice and they also seek for legal advice. Men registering land in wife's or daughter's name. Though at the beginning of our program we never thought about this kind of change could happen, because we don't talk about whether they should, hand over the land to their wives or assets, but it is happening. Husband stop beating wife. In most of the villages you go, they will say, no, we don't have wife beating and things, but it's not scientifically proved yet. Child marriage incidents for girls under 18 is stopped for 83% in those areas. And child marriage incidents for boys who are under 21, also like 78% are stopped. I'll just give you one more number. these men are mostly, they're quitting their habits of gambling, staying outside of the house. So there is one indicator, men coming early in the evening to their own house, because now they believe this is a place which is, kind of to enjoy and spend time. So this is happening, like 70% men quit gambling and drinking habits, another 86%. So these are a couple of only numbers there. So how do we there are different areas, of course, internal and external. Process monitoring, we go door-to-door visit. There are a couple of anthropological visits, like we go stay for the whole day to see what are the changes happening in this household. Also we talk to the children of the community of the household, and also neighbors, really. Those are very important resource for us to understand what really is happening. And our staff goes and stays for the whole day, spend whole day sitting nearby and said, okay, I cannot write my report in my office because office is so busy, so can I just sit, near to your house, Chachi? And this Chachi said, okay, go on, do it. And we think that they forget about her after, some time. So they can at least observe what is happening, whether this man is really washing her clothes and putting it, doing things like that. For output monitoring, of course, we use questionnaire, survey, focus group discussion, in-depth case study. And other than that, external monitoring and evaluation done by, these are like program monitoring and the monitoring I was talking about. Obviously, our research and evaluation division, sometimes we invite others to do the study, donor assessment and all those. So, what are the challenges we have? Lack of skilled human resources, including adequate gender perspective, include for capturing in-depth changes is very difficult. And obviously, the field level staff you are hiring with a very small amount of package, and building this extra capacity of understanding gender, in that level is very difficult, very challenging. Shortage of required time in time-bound projects. So while I was talking about the program working with the school, so we thought, okay, 2 years will be enough, and after 2 years, community will take charge. And it was happening, and we kind of gone to different places. And we find out that these community people, they are building a network. They developed a network, district network, they say. And then obviously that they need some support for, building it, maintaining it, making it really active and things. Though they are taking so many activities proactively, it's like beyond any of our imagination. Even when there is this World Cup football World Cup happening, so in every town you see this big screen that people see football. And these community networks people, they said, okay, there are 15 minutes per session, 15 or 20 minutes per session, and it's like whatever advertisement is going on. Why not we put our own videos, own sexual harassment, things like that. And that was really amazing thing happened. Like these people who are normally non-touchable by the program, they all get involved and talked about or starting coming back to these people. Okay, what are you doing? What is happening? Kind of thing. So these community groups, when they have started building their capacity, we are not there. So these time-bound projects are very difficult to manage and to kind of promote the changes. Of course, everyone interested in quantitative number results is a challenge for us. The know-how to assess changes related to gender equality, justice and empowerment is for us almost absent. So it's like whatever we're doing by learning. So the presentation when I was here is, oh, this is what we need. Because there's so many, things that the presenter was talking about is very nearer to our thinking also, that we are thinking on those things. And another difficult area is breaking the silo mentality for thematic integration. So when we're talking about SRR, sexual and reproductive rights, and when you talk to health, they will think it's the service delivery, or it's only about health. So rights part is always is difficult to bring into it, or any other program. So it's like every time when you are talking, like if you talk about maternal neonatal mortality, if the men and women understand and they have a respectful and peaceful and good relationship, obviously we believe that you can manage child and neonatal mortality even the part better than in any time. But so difficult to make those people understand because they are so locked into that area. So this is another challenge which we are trying to break in, but it is a challenge. So what to next? What I'd like to end with is that whenever we are working with building sensitivity, gender sensitivity, equality, you are talking to people, you are working with, so that everybody get nourished appropriately. So reducing the risk of illness and, spending money for that. When you are talking about, always gender program is a non-cash earning program, but you can save so much out of it. And I'm referring this in the context is that when one of the program, this gender equality action program was studied, so when our alter poverty program is working with gender program, in there 76% household has achieved significant amount of income and assets. When this alter poverty program working alone without any gender intervention, it is only achieving 26 or 29% significantly higher results. So from that, very obvious, whatever program we do, if we bring, incorporate whole gender sensitivity into it, that will be really that will give us a very good results. And even when we are talking about a study which is very women friendly, the cost of violence, then also our experiences in cost of violence study also, we only estimate the cost of her absence from her workplace and the cost of the treatment. But the other cost, her mental agony, the displacement and all those is not really we bring in. And just by cost of adding these two things, treatment and absenteeism, it said it's like 2% of GDP is equal to 2% of GDPs. So we would like to see the people who does those study and monitoring and evaluation also include very gender norms changes in there to receive the real results. So why we expect gender thing will be free? If you work with accounts, everyone has to be accountable for their own budget, and we need a finance department. We can't say, well, we did finance training last year, so we don't need a finance department anymore. So this is one of my friends, gender and organization development expert, who said that this is very true when we talk about any gender program. Like, okay, you are doing it for last 2 years or 5 years. So why things are not changing? This question is always there. So this is how we get very interested to come and talk to this group, so that we would like to see that people are become more interested to analyze those areas and give us the better result, appropriate results. Thank you very much. I think that's it.